Okay, I'm Mandy Malden, and I am the Faculty Civics Fellow, and have been working on putting this week together. April Ambalina, who's doing the presentation, was part of a faculty learning community during winter and spring quarters on bringing dialogue to the classroom. So this is a project that she's been working on the last 2 quarters. And April is an associate professor of nursing with a master's in health sciences education and over 10 years of nursing education experience. She has taught and mentored nursing students and nurses internationally, including a community health clinical course in the Dominican Republic. April is an avid international traveler with a strong foundation in intercultural awareness. During the pandemic, she created innovative ways to bring lab work and skills testing to students virtually, using YouTube and social media to increase engagement and build community. Thank you for being here.
Happy to be here. So I started this project actually probably over a year ago. So in 2022, probably winter quarter. And being a part of this learning community actually was perfect timing, because I think I was in a place where I was starting to integrate health disparities into my MedSurg 1 course, which is the 2nd quarter of the nursing program. So they're quite fresh to us in the program. So I had an idea of how I'm starting to integrate these health disparities, but I really wanted to make the classroom more transparent, more open, more dialogue that isn't objective and medical, and get into the deep questions and thoughts surrounding health equity and our global strive to improve health equity. So this was perfect timing, being part of this learning community and being able to integrate a lot of relational dialogue strategies into the classroom. Okay, so my goal, I had 3 primary goals starting in winter quarter. I wanted to help students develop understanding of health inequities and their causes. I wanted to help students foster empathy through storytelling and then connect them with real life experiences. And I wanted to create a safe and inclusive classroom so that they would be free and open to share their personal experiences and other diverse perspectives that they may have. Those were my primary goals that I was working on winter and this spring quarter. So this was kind of my main framework in a way. I wanted to integrate all of these areas around achieving health equity into the MedSurg class. So this class, we're talking about diabetes, hypertension, pain management, UTIs, infections like COVID-19. So at first, I'm like, there's not enough space to integrate these areas. How can I do this? So I started to think of a way to integrate at least one of these health equity factors into every single class. Okay, so this was my biggest why. I came across this really great article and it gave me really good concrete strategies on how to start integrating health equity topics into the MedSurg classroom. This was my favorite one. It said, give cultural context to case-based learning. So we do a lot of cases in our nursing program. This is a theory classroom. And to start to give the patient a culture is one thing, but to really have students ask good questions and be curious, I think it takes a little bit more than that, and to add more of like a storytelling style, which I'll give an example of in a little bit here. These were also some very concrete strategies I started to integrate and think about. So how can I discuss how systemic racism and bias cause health disparities? Calling attention to statistics and demographics in research. How can I be inclusive while doing this? Differentiating facts from myths. And we did agree in the nursing program that we don't want to lecture on what health equity is. We want to integrate it into the content that is already there. And the last one is factor in current events and pop culture, which I also really strive to do. So kind of taken all of these strategies and how can I make it into one concrete kind of framework to start getting students to have dialogue about health equity. Okay, so these were my three primary ways of thinking. So I wanted to eliminate the standalone lectures on health equity and integrate health equity content in relation to other topics that we currently had, such as diabetes or hypertension or pain management. And I wanted to give the culture context through a story. So not just giving them a case, like a 5-sentence case, but how can I tell it through a story? And then I wanted to use pop culture or media, so whatever was trending in the news topics. Okay. And as I was doing this, I knew that I had to have a way to make sure that everyone felt included. And we know we always have those very quiet students in the classroom. So how can I give them a voice? So doing something like polls and making it anonymous and having it pop up on the screen, which a lot of faculty are already integrating. So in the Learning Commons, we learned the first step to even start good open dialogue is to establish your class norms and create a culture of trust, openness, and safety. So my first class always starts off with asking them to stand up, introducing themselves, and then asking them to share things that maybe not have been asked of them yet. So I asked them to share their pronouns, their race, their ethnicity, their culture, and then who's in their family, however they want to define it. And I start off with myself. I am April Ambalina, she, her, hers. My race is Asian. My ethnicity is Filipino Chinese. And my culture, I'd say I am Filipino Canadian. And my family, I have my partner and my little 12-year-old dog that I live with. So giving them role modeling what I want them to do always kind of starts to build that trust with my students. And I find it's a fun way. They get to see more than a teacher in front of them, and they get to ask more questions. You'll see as I kind of give you examples of what I use in my class, I tend to bring my family into the storytelling and the different scenarios that I've come across. Okay, so this is where I generally will give them a couple minutes and I say, hey, you don't have to say everything and you don't have to be 100% sure. This is our time when we are learning about what's race, what's ethnicity, what's culture. And usually in this first little bit here, someone does ask what's the difference or give us examples. And it's interesting to see students really not have that concrete understanding of what their own race is or what their own ethnicity is. And it's a very interesting chat amongst themselves. So I usually get them in groups of 3 or 4 in their little tables, and they can share these things with each other and as much as they want or as little as they want. And it's really fun to hear them getting to know each other at this level and laughing about it and saying, oh, I didn't know that, or I had no idea. So it's really interesting. Okay. Then we start, after this activity, we get into the fact that we are going to have some hard discussions and conversations in class. We're going to talk about things like homelessness, racism, nurse bias and healthcare provider bias. We're going to talk about the opioid crisis. So we want to create a classroom norms together. And then I give them some suggestions and I write on the board. So whenever we do this activity, similar to what they just did, introducing themselves, I call it think, pair, share, or think, group, share. If they're not comfortable, they can feel free to step out and they can feel free to say pass if they don't want to share. They can, and we also can recognize the share does not have to be about them personally. So if we're asking, for example, I do ask students to share a time when they've experienced pain in our pain class. So you can make it up. You can say it's a friend of a friend's pain, or you heard this on a TV show. So you don't have to personally say it is about you. And you can ask questions, but don't pry. So we're learning assessment skills in this nursing class. So when your peer is telling you about their pain, don't try not to pry, but ask questions. And it's okay to respond with, I'd rather not say. And then students will add to this list of what they also want to to add to the class norms to create this safe space where everyone's open to share, but open to also step out or pass when needed. Yes.
You just mentioned class norms, which I really appreciate. So I'm standing here so we can make sure that the people hear. Can you talk a little bit more about the intentionality, or what is the process around the creation of the norms themselves?
Yeah, so my intention is to, for one, give students a way out if they're not comfortable. I have come across students, not even talking about hard conversations. I've had students where we're learning about seizure disorders and they have family who are going through that. And they've asked me in the past, can I step out? I can't focus on this content. So giving them this option to think about, okay, what do they need from a classroom where they can feel okay to learn and be open to other people's experiences, but also feel okay to say, hey, I need to step out for a second. We also have simulations that are hard sometimes, and we also have a similar classroom norms for simulations, but we're not very, intentional with doing it in a theory classroom. So that was my biggest intention. Like, how can we show students, hey, this is really important in the theoretical classroom as well? Yeah, thank you. Okay, so my question for everyone, I don't know if you can see this on the bottom of my screen.
Yes, we can. You can't, but we can.
I can't.
I don't know why it's showing up there.
See if I can click this here. Okay, so I do use polls, and at some point I will get students to try to open up and make the classroom inclusive. So for students who are not quick to put up their hand or quick to just unmute themselves or state their ideas, they can do it in the poll form. This is just an example that worked really well with Google Slides. However, I tend to use poll everywhere, which gives a lot more freedom and it's a lot more free options. This one is just multiple choice. I really like the open board on poll everywhere because it's not multiple choice and students can write whatever they want. And it is anonymous. They can keep it anonymous. So something like, what are other ideas to establish this classroom culture of openness and trust and being inclusive? So faculty or students can chime in and they can take the QR code, so you can try it if you want, or you can also join by typing in livepolls.app/ and then the letters and numbers there. So just to give you an example. And then it all pops up for the class to see. It also opens up discussion as well.
Are you asking us to do it right now?
Just a sample. We'll wait. Thank you. Okay. So I also kind of a step up from that. I also wanted to foster this community of inclusiveness, authenticity, and vulnerability. So I thought that the best way to do this, and I somehow just did this one time without even thinking, but that was the best conversation I ever had with my class. So sharing my own personal examples, making it appear, well, it is real, authentic, and shows a sense of vulnerability from the speaker. It also, I found role models for the students. So, for example, in our pain class, I'm going to share my worst pain. And I ask students, okay, think about a time, just take a minute and think about a time when you have had pain in your life, or someone has told you about their pain. So it doesn't have to be you. So I'm going to tell you about my pain. I had pain at 2 a.m. and it was excruciating. It was my lower back, left and right side. And it was like an 8 or 9 out of 10. And I didn't know what it was from. 2 a.m. was thinking, hey, should I go to the hospital? Should I not? Kind of waiting it out, but really couldn't move. Nothing was making it feel better. So at this point, we're learning about pain. And I might put a poll question up and say, what do you want to ask me? Or what would you like to know more about? And usually for the first couple of classes, I let students respond however they want. They can just speak out loud, they can put up their hand, they can put it on the poll. So giving multiple options, I find really does open up the conversation a lot. So we'll listen to people in the classroom speak out loud, and then we'll sometimes go to the poll and pick out certain points that people say. So that's my personal example. And then I tell them what they came for, the med-surg knowledge around it. So I don't know what it was to this day. It went away in 20 minutes. And then they started asking me questions. They found out that I took antibiotics for an ear infection earlier. And then I also took naproxen, which is NSAID, non-steroid anti-inflammatory, around the same time for headache. So then some students were able to grasp the idea that, okay, drugs that could possibly affect your kidneys, maybe it was kidney pain. I was like, yeah, that's what I was thinking in the end too. So kind of showing them, instead of using our objective way of assessing pain that they learned, which is our PQRST, they kind of learned this, memorizing this, hey, where's the pain located? What's the quality? Does it radiate? Giving them a story and seeing, hey, where is your curiosity taking you? What do you want to learn from the patient? So they really enjoy this activity. So I give them that example, and then I tell them, okay, now it's your turn. So now I get them to go in their little groups. I say, think about a time when you experience pain, share the symptoms with your peers, and see if your peers can ask you the right question and figure out what your pain is. So this is our little pain exercise, our introduction to pain management and pain assessment for our patients. Then I get them to switch and do it again. And it's super, super interesting. Everyone is quite open, and we learn a lot about different types of pains, and every little group will share a story. I ask them, hey, who wants to share a story, or who would like to say to the whole class? We do a little bit on the class. The most interesting one was he shared the symptoms of heartbreak. So it was super cute, and everyone was listening intently, and we were trying to figure out, what is this pain? And then someone after asked, is that real pain? And that also opened the door to a very interesting conversation around mental health, stress, and other factors related to pain that may not be very clear at a beginner's level. So really interesting class, that one. Okay. So I also aim to give the why at the end. How do you transfer this activity to real life? So I asked the students, okay, so you are with your peers, students that you know, can you see yourself being a nurse to a patient and asking these questions and being curious and trying to figure out their pain? And then we get into issues in our current nursing world with pain management, and show them some statistic about how a lot of people's pain is not managed well or is mismanaged. And that starts to open the door to more health equity topics and conversations. Okay, any questions so far?
So can you just say again, when in the quarter is this? Because I like how you have the top, fostering community inclusiveness and authenticity and vulnerability. When is this the second time? So you've already given the example before. Is this the second time that you're really working on this kind of community stuff, or where in the quarter is it?
Yeah. So pain is our 4th class.
Oh, so it's still pretty early.
It's pretty early, yeah.
Okay, have you found that students, what do you do in circumstances in which students are still not quite ready to share?
Yeah.
Or like the pain that they're thinking about might be one that is a little bit too personal.
Right, yeah. So there are still students that will not share. In a group of 4, there might be 1 out of the 4 that tends to stand back or waits till the very end and not have enough time. I think at this point, class 4, we're still kind of exploring and building the trust, that I'm not not strict or like needing students to be open in that way. I think that it's also, for some students, they learn a lot from listening. as well, not necessarily being the ones to speak about it. So far, I haven't seen any feedback in that area from those students. So this is class 4, and I find that this one does get the most talk. And then the class is much more vocal with the next classes. So yeah, that's a great question. I'm thinking adding a survey question that's more geared to those quieter students and seeing how they really feel about this activity or exercise.
Yeah, or like a reflection.
Yeah, a reflection.
Which is something I'm really good.
Yeah, a
Yeah,
reflection might be interesting. Yeah. Yeah.
Which it seems like there is scaffolding built into it.
Mhm. Right. Yeah, reflection is something I haven't tried yet. Yeah, that's a good thought too. Okay. So our next class on pain, I start to use my real life storytelling examples. So I say something like, okay, this is my mom. I got this text from her last month. And she says, so I guess my pain before naproxen is 8. Dad said if it's a 10, I would be screaming to go to emergency. And now it's probably 5 since no more steady pain. Only arm is still stiff, can't lift it yet. Should I take both naproxen and baclofen for today? So I always get students to think, okay, this is your mom. What do you guys want to say? What questions do you have? So giving them this kind of story, I'm not just saying, hey, we have a female, 62, Asian with pain goes to emergency. Giving them this real life example, I usually say, hey, you're just nursing students right now, but actually you will find your friends, family are going to start texting you these questions. You are a nurse in your community as well as on the floor in clinical. So we have to recognize, hey, how can we start applying what we learn? And that's kind of my main goal for students to see the community perspective of what they're doing and recognizing, hey, this class isn't just for your exams. We can start to use this knowledge and these skills right away. So throwing in the health equity piece here, looking at this very real, authentic text from my mom. This actually is a text from my mom. That's not a picture of my mom. This is a real text from my mom. What health equity issue could be a factor for your mom or my mom? And then I would phrase that as a poll question. And then we can start to think about and unpack and dissect this text message. And it opens the door to what students are wondering about or thinking about when they are thinking, okay, how do I respond to this? So not only do they have to understand, okay, what is naproxen, what is baclofen, how do you assess pain, what are they asking? They also need to think about like the behind the scenes context from this person who has that cultural context behind them. Yes.
Rachel put in the chat. I'll try to project. Rachel put in the chat that a relatable example is a great idea. That's for me.
Yeah, I just love that. I love that there's not just like, here's the patient and she's a white male and white female, and it's just nice to, hey, your mom texted you. What are you gonna do? It's great.
Hey, yeah, and they love it. They're just like, at first they're just kind of shocked and they're like, oh yeah, and you see a lot of head nods and they really do hear it and relate. And I do ask a survey question at the very end. I can't remember exactly what it is, but it's, do you find the real life examples valuable for your learning? And a lot of them say yes, and some even say it's as if it's a simulation, not a theory case, which I kind of saw that frame. Now they're like, put them in the driver's seat and they actually feel like, okay, yeah, what if this was my mom? What would I say? What would I want to do? How do I want to care for this person? Okay. So this is, so after I started integrating these storytelling real world examples, I wanted to really be clear about which health equity topic or concept I was integrating into each class. So with pain, I wanted to start that conversation around healthcare provider bias or implicit bias. So our own personal bias as healthcare providers. Okay. Then our next class on pain, I wanted to throw in a trending hot topic or something in pop culture. So the opioid crisis is one that they have all heard about. And then we kind of move into our understanding about implicit bias and open conversations about the opioid crisis. So this one I do a lot of hybrid mixed modes. I get students to watch videos on the opioid crisis and then ask them discussion board questions. And this quarter, I was more intentional with what we've learned in our learning commons, how to make those discussion boards better to get the outcome that you want. And I found it was very successful by just tweaking those prompts a little bit. I was able to elicit really good discussions where students just had better perspectives to share in the classroom after those discussion boards. So really interesting topic as well. Students are very open in discussion boards. Even when the prompt is not to share things about real life, they tend to go there at this point. So this would be class 5 and sharing really interesting, heartbreaking and inspiring stories from their own personal stories, families, or people they know. Okay. And just another example, my first actual class is on infection, and I use COVID-19 to integrate the health literacy concept of health equity. Okay, here's another example. They really like this one. So, again, your mom calls you. She's very anxious. She tells you your dad's not feeling well, refusing to go to the hospital. His home blood pressure was 210/95. What do you do? What do you tell your mom? So this is how I really frame the cases now that I use in class. So there's still case studies, but I just make it real. And it was actually quite easy for me. Every concept that we hit in MedSurg 1, I was like, yeah, I know someone who has a story about that. Or of course someone has pain. Or of course I know someone who went to surgery. And I was able to, with their permission, of course, and I can even use photos and their text messages. So it makes it really real for the students. So that's how I frame it. And then I show them our Facebook messages. So this is my family's Facebook chat. Felisa is my mom, Lee Mark is my brother, and Marissa is my sister. So my mom says, so after I share this case, students say yes, we tell them go to the hospital now, check your blood pressure again. So that's exactly what I did. So I confirmed students are correct. That is the right action. Tell your parents to go to the hospital. So my dad did go to the hospital. And then my mom said, so looks like he got a better doctor today. And my brother agrees and says much better. And my brother says blood pressure is 166/84. And he asks, what did he eat that is different today than normal? And he knows the answer to this, but he's just giving my mom a hard time here and kind of giving our entire family the play-by-play of what's going on. I live in Seattle. My parents are in Vancouver with my brother, and my sister was, I think, in Spain at this time. So he says, what did he eat that is different today than normal? He had coffee, which he doesn't normally, and he said, mom gave him dessert at the Chinese restaurant. Come on, mom. And my mom says, what the H? He said you gave him sweet dessert. And my mom said, his blood sugar is okay. That's not the point, Felisa, which is my little brother lecturing my mom. That's his movie. We have to fix his diet. And then my mom said, so Lee Mark, you monitor his food starting tomorrow until you leave. Then joy takes over from there. So this is a really fun, they all laugh. And this is a very real Facebook messaging chat in my family, very common. So then we unpack what's going on in this family and what's going on with this treatment plan and what are the health equity concepts around here. Even that first statement. So it looks like you got a better doctor today. How do we feel about that statement? And students love this. They talk about it and they ask a lot of questions about my family. They say, hey, is your brother in healthcare? Is your mom in healthcare? And they learn a lot of things and they just have really real curiosity. And it's quite interesting to see where they go. And then I ask a survey question at the end of this class. Do you feel empowered to start helping your community, like your family or your friends or patient, and they all say yes, like strongly agree. I feel empowered to help in my community or start making suggestions, change your diet and how to like support people in improving their hypertension or diabetes, which is really like my end goal in those classes, to make sure my students are empowered to start like applying their learning now. Okay. And this was the case, what it used to read. So just to kind of give you that background. So case male, Filipino, 62, admitted. So you can see how it's kind of different when you use a story or when you use like real life text messages. It just adds a different dynamic that allow students to be more open to ask about health equity topics and kind of go in that direction. Okay. This is just another example of the poll. So at this point, you might say, I might like throw in the poll, say, what do you say to your mom? So it kind of does establish that kind of simulation like feel. And then I usually respond back like, okay, these were the next text messages. This is what happened. And then it actually goes into the real med surg concepts. I show them what the doctor prescribed to my dad, how long he took in the hospital. And then that story goes quite long. I show them a video of us going into my parents' pantry and taking out all the cans of food. And we said, okay, this is the first step to you're no longer allowed to eat cans. And then students were actually like, oh, wow, that's really great to see a very clear, concrete step. Instead of saying to a patient, hey, change your diet, don't eat too much fast food, you can see a very clear step. And then we talk about, okay, what about patients with no support or no family support, and then kind of gets into like all of those areas where they're really thinking about, okay, how do we help our hypertension patients? Okay. So this is generally my process for anyone who wants to think about kind of changing or reframing some of their classes in this way. So I first liked to research what's new in health equity and diabetes teaching or hypertension teaching. And then I made a list of health equity topics. So I'm trying to also reframe some of my other classes, like my pediatric classes, and I'm starting to use AI, and it's really great, actually. Instead of like twisting your brain and really trying to think of like what are the main topics related to pediatrics, AI can help. And sometimes I also look at like what's the top 10 global issues today, and then I just match up these concepts with the topic of the week or whichever one aligns very well. So for example, diabetes aligned really well with implicit bias. Pain also aligned well with implicit bias. Hypertension, like culture and implicit bias. And homelessness, we started talking about bias around like drug users coming into the hospitals and such. And then what is the healthcare provider bias with those patients or that kind of population. Yeah.
I love this. I love all the stories and everything. I was wondering if you had thought about or if you could add an extra layer, either positive or just extra work on your end, to reach out to organizations that work with these populations to get some stories from them. So like you were just talking about homelessness. Right. So what is a story of someone who they knew that they were supporting who was turned away, for X or Y reason from a hospital, or someone that they were supporting who was trying to deal with, their own substance use disorder, or talking to a food bank about how they've guided people who utilize the food bank on, for those who have diabetes or hypertension or things like that. And getting stories from them to touch a little bit more into the implicit bias and how people who actually support those folks see it.
Right. Yes, that's a great idea. I actually thought of my first thought was other faculty, like what are their stories, and I started to kind of use those stories. But that's a great idea to actually use our community. Yeah. Yeah, that's a great idea. Yeah. And I actually, and I'm pretty open with my students. I tell them, look, I'm not an expert in health equity or racism, or we're all here to learn from each other. But we can unpack these things together. So when we hit the homelessness area, it's definitely an area that I don't have much experience in or have relatable content. So that's one that's a little light in the conversation. I find. Oh, great. That's great. Yeah, that is the next step. It's definitely like always a work in progress. Every quarter, the course changes or that class changes in a certain way, or it might change the story or increase it a little bit. Okay. This is just an example of how I started to map out my topics. What are my real world issues? And then what was the health equity concept that I integrated into that class? Thank you. Yes. Okay. And this is my last slide. So if you want, you can try it, maybe use AI. So I find that I'm not an expert in AI, but just even typing in a prompt like, what are health equity topics to integrate into my physics course? It will find things that you're like, oh, that makes sense. And then you can align it with your content. So I find it's a lot easier for me to kind of get the ideas from the AI first and then tweak it a certain way. Yeah, that's all. Any thoughts, questions?
That was so interesting.
That was really interesting.
I love that.
Thank you.
Well, and it seems to me, and correct me if I'm wrong, I mean, dialogue is throughout this, but it doesn't scream dialogue. It's like a real life application,
Yeah.
right?
Yeah.
Where you're sneaking it in,
Yeah.
which seems like would open people up, you know, they'd be more willing to share. So that was the biggest thing that I noticed, but it is relational dialogue because of having structured it.
Yeah.
I'm all about relational dialogue now.
I've asked a good kind of questions so far, nothing. I'm going to sit in the chat. How do?
And I love that this is going to be in the module.
Yeah.
It's going to be awesome.
Yeah, that'll be good.
Yeah.
Excited for that.
Yeah.
All right, I'm going to end the recording.
All right. Thank you.
And I'll do my everybody. So hold on, I'm sending the recording.